All right, ready to play detective. Today, we're going to crack the code of the cardiac exam.
Oh, I like that.
Yeah, we're going deep, deep into how med students learn to understand the heart and the whole circulatory system, really.
The whole system, yeah.
We're working from this document called Cardiology Top Tips. And it's full of these insights into, like, what to examine and why. Have you ever wondered what doctors are really seeing, like what those little signs mean?
Yeah, it's like they're speaking a secret language.
Yeah, totally, totally. Well, we're gonna learn that language today.
Let's do it.
All right, so the guide really emphasizes this super systematic approach, head to toe.
It makes sense, right? You don't want to miss anything.
Exactly. So first up on our journey, the hands. What can hands tell us about the heart?
Oh, you'd be surprised. Like clubbing, for example.
Clubbing.
Yeah, where your fingertips like get kind of bulbous.
Okay.
That can be a sign of low oxygen levels over a long time. Basically, your body's trying to improve the oxygen delivery, so it releases these growth factors.
Oh, so it's trying to help.
It is, but it ends up causing those changes in the fingertips.
Wow, so the body's like working against itself in a way.
Yeah. And it can be a sign of some serious stuff, like heart defects or endocarditis.
Endocarditis.
That's an infection of the heart's lining.
Oh, wow. So we're really getting clues about what's going on inside just by looking at the hands?
Yeah, exactly.
What about nicotine stains? I'd imagine those are a pretty clear sign.
Oh, absolutely. Nicotine, it narrows those blood vessels, puts more strain on the heart.
So it's a direct link to heart health, those stains.
Direct link. Then there's these tiny blood clots under the nails, splinter hemorrhages.
Oh, yeah, I've heard of those.
Those often point to, you guessed it, endocarditis. Little clots break off from the heart valve and get lodged under the nails.
It's amazing how these tiny little things can be so important.
It is.
Okay, so we've moved on from the hands, and now we're at the eyes. Why do doctors check the conjunctiva, like the inside of the eyelid?
They're checking for pallor.
Pallor.
Yeah, basically paleness can be a sign of anemia.
Okay.
And anemia means your blood isn't carrying enough oxygen, so the heart has to work harder to make up for it.
It's fascinating how these things are all connected. What about the mouth?
The mouth, we're looking for cyanosis.
Cyanosis.
Yeah, a bluish tinge, in the lips or gums, means oxygen isn't circulating well.
So the heart might not be getting the oxygen it needs.
Right, and that brings us to the neck. We want to pay attention to the carotid pulse.
Right, the carotid arteries, those are the ones that go to the brain.
Those are the ones, important ones.
Right.
We check the pulse, see how strong it is, what the rhythm is like, and we listen for bruits.
Bruits, what are those?
Kind of like a whooshing sound.
Okay.
Could mean the artery's narrowed, what we call stenosis.
Oh, so that whooshing is the blood trying to squeeze through.
Exactly. And that increases the risk of stroke, so we want to catch that early. Now then, there's the JVP.
JVP.
Jugular venous pressure. It's like a pressure gauge for the right side of your heart.
Oh, okay. So how do you check that?
Well, you look for the pulsation in the jugular vein in the neck.
Oh.
If it's high, could mean the heart's not pumping well.
Ah, I see.
There's also this test, the hepatojugular reflex test. You press gently on the abdomen.
Okay.
And that increases blood flow back to the heart. If the JVP goes up a lot and stays up, not a good sign.
So even just looking at the neck veins can tell us a lot.
Yeah, it can.
Now moving down, what about the chest? What are we looking at there?
Well, the chest tells a story. We look for scars, from any surgeries, maybe a bypass or a valve replacement, any deformities, any visible pulsations.
So those scars are like a map of their medical history.
Exactly. Really helps us understand the current situation. And speaking of location, let's talk about the apex beat.
Okay, now I'm picturing like a treasure map with an X marking the spot. But really, what is the apex beat and what can it tell us?
It's the point where the tip of your heart bumps the chest wall with each beat.
Oh.
You can usually feel it in the fifth intercostal space, in line with the middle of the clavicle.
So if it's somewhere else, or if it's really strong, that could be a problem.
Exactly. It could mean the heart muscle is thickened, which you see with high blood pressure. Or a strong beat might mean hyperthyroidism.
Which is?
That's where your thyroid gland's making too many hormones and your heart's racing.
Wow, so much information from just one little bump. It's amazing.
It is. And that brings us to the next part of the exam, auscultation. All about listening to those heart sounds.
Ooh, the symphony of the heart. We'll have to dive into that next time. All right, so we've been exploring all those visual clues.
Yeah, like a detective, right?
Exactly. But now it's time to actually listen to the heart. We're talking auscultation.
Ah, yes, auscultation. The art of listening to the body, in this case, the heart.
And our instrument
Mhm.
for this is, of course, the stethoscope. You mentioned before that doctors use both the diaphragm and the bell.
Right.
Why is that? What's the difference?
It's all about the frequency of the sounds. The diaphragm, the bigger, flatter side, picks up those higher pitched sounds. Like the lub dub, the heart valves closing.
So the lub dub is actually two different sounds.
Two distinct sounds. The lub, that's the first heart sound, happens when the mitral and tricuspid valves close.
Those are the ones between the atria and ventricles, right?
Exactly. And then the dub, that's the second sound. That's the aortic and pulmonary valves closing. Those are the ones sending blood out to the body and lungs.
It's like a perfectly timed, coordinated dance. But sometimes I imagine you hear things that are offbeat.
Oh, absolutely. That's when things get interesting. One of the most common things we hear is a heart murmur.
A murmur.
Yeah, it's like a whooshing, swishing kind of sound. Means the blood flow is turbulent.
Turbulent, like rapids in a river.
Yeah, like that. Something's disrupting that smooth flow.
So what could cause that?
Lots of things, actually. Could be a leaky valve. We call that regurgitation. Or a narrowed valve, that's stenosis.
Yeah.
Could even be a hole in the heart.
Wow. So hearing a murmur, that's a sign that something needs a closer look.
Definitely. Now, some murmurs are harmless, especially in kids, but others, well, they can indicate bigger problems. So that's why we listen so carefully. The timing, the location, how loud it is, the pitch.
So many factors to consider.
It's true. It takes a trained ear, to really understand what's going on. We also listen for other sounds, too, not just murmurs.
Like what?
Well, clicks, for example, those can be from valves not moving right, or snaps. Those can happen with mitral stenosis.
Atrial stenosis, that's when the valve is.
Thickened and stiff,
Mm.
doesn't open properly. And then there are rubs, which can mean the pericardium, the sac around the heart, is inflamed.
So each sound is like a clue to a different part of the heart.
Precisely. It's amazing what you can learn just by listening.
Now, earlier you mentioned aortic stenosis, the narrowed valve. What would that sound like through the stethoscope?
Oh, that one's pretty distinct. It's a harsh sound, kind of a crescendo decrescendo, loudest at the base of the heart, and often you can hear it radiating up to the neck.
So it's not just whether there's a murmur, it's the specific qualities of it.
Exactly. And those qualities, they change depending on how severe the stenosis is. The narrower the valve, the louder and longer the murmur might be.
You also mentioned collapsing pulses, which I have to admit, it sounds a little scary. What do those sound like?
Collapsing pulses, that usually means aortic regurgitation. You hear this blowing sound, but it happens during diastole.
Diastole, that's one.
The heart's relaxing, filling with blood.
Ah. So the leaky valve lets the blood flow back, and that's the blowing sound.
Right. And often with aortic regurgitation, you hear other things too, like the S1 sound, the lub might be louder. And the difference between the systolic and diastolic blood pressure, what we call the pulse pressure, is wider.
So many nuances to listen for.
There are, but
Yeah.
that's what makes it so fascinating, right?
It does. Now, I remember from med school, sometimes you have patients lean forward when you're listening to their heart.
Ah, yes. That's to bring the heart closer to the chest wall. Makes certain sounds easier to hear, especially murmurs from the aortic valve.
So it's all about amplifying those subtle sounds. What about listening during deep expiration? Why do that?
Same idea. Deep breath out. The lungs get smaller, heart's closer to the chest wall, makes those quieter sounds easier to pick up, especially at the left sternal edge and the aortic area. That's where you hear those aortic stenosis and regurgitation murmurs best.
So even how the patient is breathing can affect what you hear.
Absolutely. It all matters.
Now, before we move on, you mentioned before how important it is to know the difference between normal and abnormal heart sounds. What are some things that would make you think, okay, something's not right here?
Well, a new murmur for sure, or if an old murmur changes, that could mean the underlying problem is getting worse. Also, if a murmur is really loud or if it comes with other symptoms like shortness of breath, chest pain, fatigue,
Those are red flags.
big red flags. Means we need to do more investigating. All right, so we've listened to the heart, but now we're going to move away from the chest down to the ankles. Seems strange, right?
It does, a little. But I guess, as we've seen, the heart's connected to everything. So what can the ankles tell us?
They can tell us a lot, actually, especially about fluid balance and circulation. But we'll save that for next time.
All right, stay tuned as we wrap up our deep dive into the cardiac exam. All right, so we've traveled from the fingertips all the way down, listening to the heart, and now we're at the ankles. Seems like an odd place to end up, but I guess, as we've learned, the heart affects everything.
It really does. And the ankles, they can actually tell us quite a bit about how the heart's doing, especially when it comes to fluid and how well the blood's circulating.
So what exactly are we looking for in the ankles?
Two main things, pitting edema and any stars.
Okay, pitting edema, that's the...
That's the swelling, where you press and it leaves a little dent. Happens when fluid builds up in the
Right,
tissues.
right.
Yeah.
And that can be a sign of heart failure, right?
It can, yeah. Specifically, right-sided heart failure. Remember how we talked about the right ventricle pumping blood to the lungs?
Yeah, vaguely.
Well, in right-sided failure, that ventricle's weak, can't keep up. So blood backs up in the veins and fluid starts building up throughout the body.
Ah, so the ankles are kind of like a low point where the fluid settles. Makes sense. But what about scars? What can those tell us?
Scars, especially around the blood vessels in the ankles, could mean there's been some procedures done for peripheral vascular disease.
Peripheral vascular disease.
It affects the arteries and veins in the limbs, basically, and it's often linked to heart problems too.
So again, it all comes back to the heart. It's really incredible how interconnected everything is.
It is, and that's why a good cardiac exam looks at everything. What you see, what you hear, the pulses, even the ankles. It all adds up.
It's like putting together a puzzle, all these different clues.
Exactly. Each finding gives you another piece. Makes you think, with all the technology we have now, how might these exams change in the future?
That's a good question. I mean, we've got wearable sensors now that can track your heart rate all the time. It's like having a mini cardiologist on your wrist.
It is. And then you have AI, which is getting really good at analyzing those echocardiograms and EKGs, even finding things that doctors might miss.
So AI could be like an extra set of eyes helping make diagnoses.
Exactly. Really powerful stuff. And it has the potential to change everything about how we care for our hearts.
It's a really exciting time for cardiology. But even with all this amazing tech, I imagine that good old-fashioned physical exam is still going to be important.
Oh, absolutely. Technology can definitely help, but it can't replace that human connection, that ability to really listen and observe, to connect with the patient. That's at the heart of medicine.
I completely agree. Well, we've covered a lot today. From collapsing pulses to heart murmurs to swollen ankles. Who knew there was so much to learn from a cardiac exam?
It's a whole world in there. And it makes you wonder, with all these, will we even need stethoscopes in the future? Something to think about.
That is a great question, and it just goes to show there's always more to learn. So keep exploring, keep asking questions, and keep taking care of your heart. Thanks for joining us on this deep dive.